As a health promotion guy, it really saddens me that disease awareness has become such a dirty phrase. What used to be regarded as a noble enterprise, that is, raising awareness of diseases and educating Australians about what they can do to avoid them, has now somehow become the subject of derision by some based on an academic analysis of the risk. The criticism of disease awareness comes in a couple of forms. First, critics talk about the risks of overdiagnosis. So this is where awareness of disease is increased in circumstances where the test or the screening tool is imperfect in identifying the presence of that disease or a high likelihood of developing that disease in the future. So for example, a blood test for prostate cancer might be imperfect and might lead to lots of unnecessary biopsies and surgery, and this surgery obviously carries risks. And then there are people like Ray Moynihan and others who talk about disease mongering. So this is where the boundaries that define disease are extended to include what might be regarded as the normal circumstances of the human condition, like anxiety. So what happens here is that awareness of previously unidentified diseases is increased as a tactic for being able to commercialise that condition by offering treatments for it. But I want to bring some attention to the benefits of disease awareness and the good things that come from intervening earlier in diseases, because much of the critical public discussion around the risks of overdiagnosis downplay the benefits of early detection. There was a recent Fairfax article on Moynihan's recent study into the role that paid advisors play in making decisions about the definition of diseases like high blood pressure, dementia, high cholesterol and ADHD. But as is so often the case, the article made no reference at all to the potential benefits of early diagnosis in these conditions. To constantly emphasise the risks is to deny that good public health policy and clinical practice is a balancing act between the potential harm of the intervention that might come from identifying an early sign of the condition, perhaps some biomarker or screening image, versus the potential public health benefits that come from early diagnosis and treatment. And this is very relevant to even controversial diseases like ADHD. The portrayal of ADHD in the common media is incredibly negative. The framing is typically around campaigners who want to save children from being overdiagnosed and medicated versus parents who, it seems, are determined to drug their own kids. So let's look at a couple of questions in turn. First, do families and children get benefits from being treated for ADHD? Well, the overwhelming answer to this question is yes. I mean, I've helped lots of ADHD patient groups and manufacturers for that matter with their PR, and the frustration they feel is palpable. I mean, why can't there be good stories told, they ask. Many of them are families whose life is made more pleasant, more livable and more bearable by accurate diagnosis and effective medical treatment of their ADHD. So second, and maybe a related question, is that about diagnosis and medication. Is ADHD overdiagnosed in Australian children, and are there more children on medication than there should be? I mean, we're bombarded with stories from the tabloid current affairs programs and the newspapers about drugged up kids and an explosion in the writing of scripts for ADHD. So, is ADHD overdiagnosed and are the kids overmedicated? Well, the answer, based on the evidence, seems to be a resounding no. I mean, let's assume, based on the National Health and Medical Research Council data on ADHD, that the prevalence in Australian children is around 5%. Now, there is some evidence that the prevalence might even be a little higher, but let's stick with 5%. And then let's look at the data from one state of Australia as an example, Western Australia, which some people claim has the highest levels of prescribing in Australia. Now, the actual stimulant prescribing level in WA is 1.2%. So, pending some additional clinical discussions about what proportion of those diagnosed with ADHD should be prescribed stimulants, and taking into account the view of the NHMRC on stimulants, where they say stimulants can reduce ADHD symptoms, improve social skills and peer relations in children for up to 3 years, it would seem medication is being used at maybe around about the right levels. I mean, it's even possible, based on the evidence, that ADHD in Australia is being a little underdiagnosed and medications are being a bit underused. I mean, not that you would know that if you watch Today Tonight, read the Herald Sun or the West Australian, because the stories there are all about ADHD epidemics and a lost generation of drugged up kids. I mean, time forbids a full treatment of other diseases here, like depression, but the conclusions are similar. Early detection and diagnosis is not about creating an epidemic in depression or making more money for the drug companies or helping the psychiatrist to get rich. It's about effective early management. I mean, I help design lots of these campaigns, and they are driven out of a genuine concern for patients in light of the evidence that confirms the enormous benefit that can accrue from early intervention. Every alleged risk associated with what the naysayers call disease mongering, medicalisation or overdiagnosis carries the prospect of tantalising benefits in the form of reduced disease, healthier lifestyles, more time with loved ones and longer lives. So the next time you see reference to the risks of overdiagnosis or disease mongering in the popular media, just stop for a minute and reflect on the benefits that result from increased disease awareness, early diagnosis and more effective treatment. I mean, even for relatively controversial diseases like depression and ADHD. For more information on this, go to palin.com.au or send me a note in an email, martin@palin.com.au.